Welcome to Bridging Oral Health and Non-Communicable Diseases, a podcast from the World Federation of Public Health Associations. I'm your host, Abiola Adeniyi. So before we begin this first episode, titled The Oral Health Cancer Link, Connecting Care, it's my privilege to welcome the distinguished leaders of the World Federation of Public Health Associations. First, I'm honored to introduce Professor Raman Bedi, the Vice President and President-elect of the World Federation of Public Health Associations. Professor Bedi.
Thank you so much. I was also the former chair of the Oral Health Working Group, and I wish during my 9-year tenure I had thought of this idea, because these podcasts are amazing, and I want to congratulate the Oral Health Working Group and the NCD Working Group for coming together and putting together what is going to be a tremendous series. So I congratulate you all for doing that. Bridging oral health and non-communicable diseases is really important public health priority. I hope these podcasts are seen by all of our public health community, by healthcare professionals in general, and the public. But more than that, I hope it's seen by our politicians, and to remind them again that the mouth is part of the body, and we have to put oral health back into public health and as a health priority. So I'm going to follow this series with great interest, and I wish you well for it. And congratulations again for both the Oral Health and the NCD Working Group. Thank you.
Thank you, Professor Bedi, for those very kind and thoughtful words. And now I'm pleased to welcome Professor Bettina Borish, the Chief Executive Officer of the World Federation of Public Health Associations. Professor Borish, thank you for being here.
Thank you for having me. Thank you for inviting me. And I just underline what Raman has said, the political level. And when I created years ago the Oral Health Working Group, it was because I felt that oral health and public health have to be far closer together, if not joined. I am, and now comes my take, I'm a trained histopathologist, and I have been diagnosing cancers and cancers under my microscope. In my second life, I trained as a professor in public health. And joining these two expertises, for me, oral cancer is the easy first thing you should do. It is accessible, it is preventable, and we even have for part of them now a vaccine, HPV. And what happens? I only know 3 places in the world where there is an early oral cancer screening program, and it would be easy to do it. And countries who have a high incidence of oral cancer know how to do. Go to see your oral health specialist, talk to the public health community and the politicians, and you could really solve a very important public health problem that creates a lot of suffering. The experts are there, you are there, oncology is there, and we have HPV vaccination, and we have early detection. But the country that has a screening program is Taiwan. There are some pilots, I think, and you will hear about that in India, but this should be a population-based activity. And I hope that all of you are going to run, to plead, and to advocate for that. And that's why I congratulate you to get this topic and get the people together. Thank you very much, and good luck for the podcast.
Thank you so much, Professor Borish. Those were really heartfelt words. I'd like to thank you both for your inspiring words. Today is our very first episode, and we're starting with a very fascinating connection. It's the relationship between oral health and cancer. Every episode of our series will explore how oral health connects with different non-communicable diseases, from diabetes to oral health, to heart disease, and even beyond that. We're here to share insights about why the health of your mouth matters for your entire body. As you know, it's interesting, your mouth is actually like a window to your overall health. In fact, almost 90% of the diseases show signs in your mouth first. Let's think about this. We use our mouths every day to eat, to speak, and smile. But there are also early warning systems for our body. Poor oral health isn't just about cavities or bad breath. It can be linked to serious conditions like cancer, heart disease, and diabetes. Today, we're focusing specifically on the cancer connection. I'm excited to welcome two remarkable experts who will help us understand this connection better. First, we have Dr. Madhurima Datta, whose journey in oral cancer research spans 2 continents. After completing her dental degree at Manipal College of Dental Sciences in India, she conducted groundbreaking research at Datta Memorial Hospital, one of Asia's largest cancer centers. Her PhD work at the University of British Columbia, Canada, focused on developing innovative approaches for early oral cancer detection. Currently, she's pioneering proactive cancer screening techniques using whole body MRI technology, bringing together expertise in dental health and cancer prevention. Dr. Datta.
Thank you so much, Abiola. It's a pleasure to be here. You know, the connection between oral health and cancer has been a fascinating journey for me, from seeing patients in dental clinics in India to developing early detection methods in Canada, and now working with advanced screening technology. I'm really looking forward to sharing what we have learned about this crucial connection.
Thank you, Maddie. Joining us also is Dr. Okuku, a leading figure in African oncology. After completing his medical training at Makerere University, Uganda, he earned prestigious fellowships as a Johnson & Johnson Scholar at Yale University and the Fred Hutchinson Cancer Research Center. Today, as the head of the Solid Tumor Treatment Service at the Uganda Cancer Institute, he is leading transformative clinical trials in AIDS-related cancers, liver cancer, and breast cancer. His work has been particularly influential in developing cancer treatment protocols tailored to resource-limited settings, making cancer care more accessible across East Africa. Dr. Okuku.
Oh, thank you. Thank you, Abiola, for having me. Yes, indeed, in my work at the Cancer Institute, we do see firsthand oral health issues and how they impact our cancer patients' treatment journey. Particularly, I'm excited to discuss how we can bridge this gap between dental care and cancer treatments so as to provide better outcomes for our patients in Uganda, in Africa, and beyond.
Awesome. Thank you very much, Dr. Datta and Dr. Okuku. Thank you for your wonderful introductions. You know, when most people think about prevention or treatment, oral health might not be the first thing that comes to mind. But that's exactly what makes today's conversation so important. Let's explore together. So let me start with the basics. Dr. Datta, many people might not realize there's a connection between what's happening in their mouth and cancer risk. Could you help us understand this from a dental perspective? And Dr. Okuku, I'd love to hear how this plays out in your clinical experience. Over to you.
That's very right, Abiola. Many people don't realize there's a profound connection between what's happening in your mouth and the risk of developing certain cancers. First, let's talk about what's happening in our mouths. So conditions like gum disease, also known as periodontitis, don't just stop at your teeth and gums. When you have chronic gum disease, your body is constantly battling inflammation. That inflammation doesn't just stay local, it spreads systemically. Think of it like an alarm going off in your immune system that never stops. So over time, that can create the perfect environment for diseases like cancer to develop. For example, studies have shown a clear link between severe gum disease and cancers like pancreatic, colorectal, esophageal, and oral cancer. And here's where it gets even more interesting. Certain bacteria in our mouth, like Porphyromonas gingivalis and Fusobacterium nucleatum, have been found not only in our mouth, but also in cancerous tissues elsewhere in the body, like colorectal tumors. So these bacteria produce toxins that can damage our DNA and suppress our immune system, creating the perfect conditions that allow cancer cells to thrive. But let's bring this a little closer to home, to the oral cavity, and talk about oral cancer. So some researchers suggest that poor oral hygiene alone might not directly cause oral cancer, but it creates the perfect conditions for other risk factors like smoking or HPV to do more damage. For example, if your gums are constantly inflamed or damaged, it might make it more easier for the HPV virus to infect tissues in your mouth. So by taking care of your oral health, we are not just protecting our teeth, we might also be lowering our risk of life-threatening conditions like cancer.
Indeed, as Dr. Datta has said, the mouth is a very important aspect of our health. And it carries a lot of bacterial loads. One of the interesting viruses that leads to a huge burden of cancer in Uganda, for example, and this is based on some studies that we did among blood donors, is HHV8. This is an interesting virus that replicates in your mouth, and through that can gain entrance into your blood system and lead to cancers, about 3 major cancers. It's the common cause of Kaposi sarcoma, a cancer that I see quite commonly manifesting in the mouth of many of our patients with HIV. It also is responsible for causing other cancers like Castleman's disease. And so this is a very important virus that in one of our studies that we did, we took samples from saliva and we found that some patients with Kaposi indeed do have very high loads of this virus. And we also confirmed high replication rates. There is also a risk of heart disease. Having a huge bacterial load in the mouth, ensuring that one has good oral hygiene is important because those bacteria could affect your heart in one way or the other.
Thank you too. Now that we understand the connection, and thank you for talking about your patients, Dr. Okuku. From your experience treating cancer patients, what role does oral health play in cancer prevention? Dr. Datta, I know you're a dentist. Could you share some practical oral care steps that could make a difference?
So again, very important to ensure that our patients do have good oral health. And during our treatments, we do have complications related with our treatments. And these complications can cause many challenges, could affect nutrition of the patient. Some of the complications that we see due to our treatments, like radiation, for example, it could lead to trismus, it could lead to mucositis, and many other complications that could lead to fungal infection, bacterial infection. And so we emphasize good oral hygiene for our patients before, during, and even after treatment.
Yeah, certainly. As Dr. Okuku mentioned, that maintaining oral hygiene is very important, specifically in the cancer prevention and in the cancer journey of a patient. So some of the practical tips is mainly maintaining good oral hygiene by brushing twice daily with a fluoridated toothpaste and flossing. That can help reduce your risk of gum disease and inflammation. Avoiding tobacco products, limiting alcohol consumption can also make a big difference. And lastly, seeing your dentist regularly, not only for profession cleanings, but also to check for early signs of oral cancers, which may often appear as red or white lesions in the mouth.
Perfect. Thank you for sharing that with us. I'm very curious about the patient's journey. Dr. Datta, what oral health challenges do you typically see in cancer patients?
As Dr. Okuku mentioned earlier, so when it comes to cancer patients, oral health challenges can be quite significant, but it's often overlooked as a part of the journey. So treatments like chemotherapy, radiation can lead to oral mucositis, which is a very painful inflammation of the mouth that can make eating, drinking, or even speaking very difficult. Dry mouth or xerostomia is another common cause, which is caused due to the radiation damaging the salivary glands. So without enough saliva, the risk of cavities and gum disease just skyrockets. And even other infections like fungal or bacterial infections are more likely since the cancer has weakened your immune system. Some patients even experience taste changes where the food like tastes metallic or bland, affecting their appetite and even nutrition. And for those undergoing radiation to the jaw, conditions like osteonecrosis, where the bone tissue dies, can develop and cause significant pain and difficulty. But fortunately, many of these can be managed with proactive dental care. Before starting treatment, a dental checkup can address the existing problems. During treatment, maintaining good oral hygiene, staying hydrated, and using specific rinses or saliva substitutes can help. And post-treatment, ongoing dental care is essential to manage any lasting effects.
Indeed, as Dr. Datta has said, we do we would love to prevent these challenges that our patients face when they are treated. One of the commonest challenges that Dr. Datta has mentioned, osteonecrosis of the jaw. It's important that patients, do not visit their dentist without information about chemotherapy. And so we inform them to make sure when they have oral challenges, they should inform their dentists or their oral surgeons that they are undergoing chemotherapy or they are on bisphosphonates. The commonest cause of osteonecrosis of the jaw is long-term use of bisphosphonates. And so we ensure that this information is shared and that the oral dental procedures are prevented during this time so we do not worsen this kind of situations. There are patients that get temporary fixation of the temporomandibular joint due to radiation, and that's a big challenge. And so we do love to, reduce that risk by involving our physiotherapy colleagues as early as possible in the treatment of patients who are undergoing radiation to the head and neck region. We also do love to inform our patients about continued use of alcohol and smoking during their treatments or while they're on chemotherapy or undergoing radiation. And frequently, we do not hesitate to use antifungals, antibacterials, mouthwash when we encounter these challenges.
Thank you very much. I found that really helpful to learn again. So let's dig deeper into patient care. Dr. Okuku, how critical is early detection in cancer outcomes?
Very, very important. Because as you know, we emphasize good nutrition to our patients, and the nutrition we do call the mouth a blender. That's what we tell our patients, because every food that we eat is taken through our oral cavity, which blends the food so that we can be able to digest that food very well. So we emphasize some visits to the oral dentist or the oral surgeon if we detect some issues in the mouth, and that's before we even start treatment. So there are patients who have dental caries, things like those that might affect their feeding. So we ensure that those are taken care of. We do not hesitate sometimes to recommend feeding tubes, what we call PEGs, percutaneous esophageal tubes that we put in the stomach for patients, or sometimes called feeding gastrostomy tubes. And sometimes we do that if we notice we might encounter challenges in the mouth, or if we have detected that there might be problems in the mouth. And so those are some of the ways that we try to go around challenges. However, in our institute, we do have a tumor board, and most patients who come in with issues to do with the head and neck are discussed with teams. And in our tumor board, our head and neck tumor boards, we do have an oral surgeon or a dentist, or dental surgeon. We also do have an ENT surgeon, a medical oncologist, and a radiation oncologist. So we emphasize teamwork. And with these colleagues on the team, they are able to sort out some of the early, they can be able to detect some of the challenges in the mouth before we embark on treatment. So early detection, very, very important indeed.
Perfect. Dr. Datta, I found it very interesting that he referred to the mouth as a blender. That's such an innovative expression. Could you walk us through how dental professionals could contribute to this early detection process?
Certainly. So dental professionals play a vital role in the early detection of cancer, especially head and neck cancers. So this process begins with a comprehensive extraoral and intraoral examination. So what we do during an extraoral examination is we inspect the head and neck region for any asymmetries, swellings, changes in skin texture or color, along with palpating the lymph nodes in the neck, under the jaw, and around the ears to check for any swelling, lumps, or tenderness. And during the intraoral examination, we systematically inspect the lips, the cheeks, the tongue, floor and the roof of the mouth, the base of the tongue, and the tonsillar area for presence of any red or white patches, lumps, or non-healing ulcers. So if a suspicious lesion is found, we often take a piece of the tissue and a biopsy. So this is the biopsy, and we look under the microscope. And when we look under the microscope, we often see precancerous changes, which is also called dysplasia. So what happens is there is changes in the cell and the tissue architecture, which makes it at a higher risk of turning into cancer. So these kind of lesions need to be monitored to facilitate early detection of cancers.
Thank you so much, both. You're sharing years and years of learning with us in such simple terms. That's really appreciated. I think one thing that would really interest me, Dr. Datta, from your research perspective, what would an ideal dental and medical collaboration look like? It sounds like you've worked with, a lot of non-dentists in doing your work. So what would you think that would look like?
That's a fantastic question, Abiola. And as Dr. Okuku mentioned earlier, that like having a dental and medical collaboration that revolves around an integrated approach to patient care is the perfect solution. So again, just highlighting what Dr. Okuku said earlier, like having both the dentist and the oncologist involved in the patient care, sharing of medical reports, which is very essential. And medical practitioners should also emphasize oral health in the discussions, educating patients on maybe how gum disease, for instance, increases the risk of heart disease or even cancers. And together they could create a unified message that oral health is integral to overall wellness and not just about preventing cavities. Another important aspect would be, as I said earlier, like a collaborative treatment planning. Oncologists and dentists kind of coordinate pre-treatment care together to reduce complications like infections or oral mucositis during chemotherapy. And lastly, we need more research collaboration between the dental and the medical community to kind of further understand the link between the oral and systemic health.
As a clinician, Dr. Okuku, how do you think this sort of integration would work out to improve patient care in clinical settings?
Very, very important. And it's common for oncology centers to have what we call tumor boards, and these are centered around disease sites. So for example, I mentioned about the head and neck tumor board. So all cancers that are in the head and neck region, the team of specialists sit together and discuss the difficult cases that require multimodality treatments and multidisciplinary treatments. So this is a very important aspect of patient care in oncology. And it is what we encourage, working together as a team to improve patient outcomes.
Thank you so much. I'm going to ask that we zoom out to the bigger picture for our final question. So, Dr. Okuku, from your experience leading cancer care in Uganda, I read your bio, you have worked in North America as well, apart from working in in Uganda. What are the major challenges you see in integrating oral health into cancer treatment and prevention, particularly having worked in resource-limited settings?
Traditionally, there's limited healthcare workers in Africa in low resource limited setting. So where I'm working, it's the National Cancer Treatment Center, and we do a lot of research. So I'm privileged because I'm working in such a setting, and it's where we treat most cancer patients in the country. So I'm privileged because we have this big team of people. But you go down to the small rural hospitals where most of our patients would be coming from. You find maybe just one dental assistant, not even a dental surgeon. And they will be struggling they do not have all that they require. They can't do a biopsy, and they are not able to send the tissue for proper histological analysis. And so these are some of the challenges that you find. Secondly, we do have a lot of practices in Africa that lead to oral dental challenges. There are about 5 different types of ways of taking tobacco. One of them is the traditional smoking of tobacco. And then there is what they call the reverse smoking. The reverse smoking, the fire is in the mouth. And then we have the sniffing of tobacco in many parts of Uganda. Then we have the eating of tobacco, and eating and ingesting tobacco. And then, of course, there are different types of pipes that people use to, smoke the tobacco through a pipe. And this is normally the raw type of tobacco. And then the cigarette, the normal customary cigarette that is smoked. So just imagine those different aspects of taking in tobacco into the body result in different types of challenges, different types of cancer. For example, if you do the reverse smoking, you may develop the oral cancer because the fire will burn, parts of the mouth, maybe the tongue, and you end up with an oral cancer. Whereas when you smoke, you may end up with lung cancer. So some of those challenges of these risk factors that we see leading to different manifestations of these oral health issues and challenges are quite challenging. But there's lack of human resources to make early diagnosis. There's lack of equipment to take tissue, or even people to be able to make a diagnosis of the tissue and be able to refer. Or the patients who are referred do not even have the money to come in time. So it's not uncommon to find patients coming with inability to feed because the tumor is filling the whole mouth, or it's a bleeding tumor, or it's a foul-smelling tumor with discharge. And these are the kind of challenges that we see in an ordinary practicing in Africa or low limited settings. These are the kind of patients that we see.
Thank you, Dr. Okuku. And Dr. Datta, having worked across different healthcare systems, how do these challenges compare globally? And what solutions have you seen work effectively?
Yeah, that's a great question, Abiola. And as Dr. Okuku mentioned, I think it comes with a unique set of challenges, especially in resource-limited settings. So one of the biggest hurdles, what I've seen back in India as well, is the lack of awareness about oral health, where oral care is often viewed as secondary to medical care. Further, there's a lack of access to oral care due to limited resources or financial constraints. And in many settings, like dental care is only reactive rather than preventive. So by the time they come to get care, it's already too late, and obviously the treatment outcomes decrease when there is late detection. So I believe there needs to be policy level changes by governments and health organizations. And I think starting this conversation is a great point of beginning. And for example, and also including other having in resource limited settings, like training primary care providers to screen for basic oral health issues can make up for the lack of dental surgeons or trained physicians. And another solution which we really saw seem to work in India was having like mobile dental clinics or telemedicine platforms, which kind of help to improve community awareness and also provide access to care in rural areas. So during my PhD, part of my research involved conducting oral cancer screening camps in rural areas outside Hyderabad, India. And as you know, India has one of the highest incidence of oral cancer globally. So what we did was we went out to the villages and we did intraoral, extraoral examinations, collected tissue for the biopsies and brought it back and referred them to the cancer hospital in the city. So we found a lot of precancerous lesions, some cancers too. And by bringing services directly to the communities, we were able to bridge the gap between early detection and effective treatment. And this initiative was also noticed by the provincial government, and they actually started a screening program in the hospital to see such patients and to go out in the community and treat such patients. I think that's a great place to begin with.
Thank you very much, Dr. Datta and Dr. Okuku, for taking your time to join us today. You've not only brought to us a clinical and a research perspective, you've brought forward to us experiences from the global north and the global south, as well as a dental and a non-dental perspective to our conversation today. I can't thank you enough. Your insights have highlighted not just the crucial connection between oral health and cancer, but also about the pressing global challenges we face in delivering integrated care. So as we've heard today, particularly from Dr. Okuku's experience in Uganda and Dr. Datta's international perspective, there is an urgent need to strengthen the integration of oral health into cancer care worldwide. So we're going to call on international organizations, national governments, healthcare leaders to prioritize this integration by providing resources and improved infrastructure that would enhance care and training programs. We at the WFPHA hope that this episode has helped our listeners, especially healthcare workers and public health specialists, understand that the connection between oral health and NCDs are very important, and there is a critical need for global action. So next episodes, in a couple of months, would also be exploring tobacco. It's interesting, our guest speakers today have touched on tobacco as an important thing. They may have spied our plan. So next episode will focus on tobacco and its connection between oral health and systemic health. So join us in May as we explore this topic. This podcast has been created by the Oral Health and the Non-Communicable Disease Work Groups at WFPHA. Thank you, and until next time, it's bye from me, your host.